meeting of the Advisory Committee for a Resilient Nevada. And at this time, we are going to start. I'd like to start by taking roll call, and I'll call this meeting to order. Joan, can you get that started for us?
Jessica Barlow, I believe she had trouble finding her invitation, but it sounds like she's coming.
Awesome.
Brittany Collins Jefferson. Silnitra Grady.
Good morning, present.
Ryan Gustafson. Dr. Kamyar.
Present.
Carissa Loper.
Present.
Catherine Loudon. Cecilia Maria.
Present.
Elise Monroy.
I'm here.
Darcy Patterson.
Present.
Pauline Sala.
Present.
David Sanchez.
Present.
Ariana Saunders. Cornelius Sheehan. Dr. Wagner.
Present.
Winnie Winbush.
Present.
You do have quorum.
Thank you, Joan. I will move this meeting forward to agenda item number 2, which is public comment number 1. At this time, public comment will be taken in consideration of others who may wish to provide public comment. Please avoid repetition and limit your comments to no more than 3 minutes. Again, we can't take any action on a matter discussed under this item, but at this time, if you are part of the public and you would like to make a comment, I'd ask that you raise your hand using the reaction feature, and I will call on you. After I call on you, if you'd like to speak for public comment, please hit that react button again so that your hand goes down and we know that you're all finished. Joan, do you see anyone with their hand up? I don't see anyone.
This is Dawn. No, but for the record, Ariana Saunders has joined.
Thank you, Dawn. I'm going to give it one more opportunity here for agenda item number 2, public comment number 1. All right. At this time, I don't see anybody available or interested in public comment. I'm going to move forward on the agenda to agenda item number 3, which is for possible action approval of the minutes from the June 15th and the June 22nd meetings. Hopefully the committee got a chance to go over our minutes from those 2 meetings. At the June 15th meeting, Assistant Attorney General Mark Krueger shared an update on opioid litigation settlements. We reviewed, prioritized our recommendations, and identified those that we wanted to move forward to the director's office. We covered legislative categories, crisis services, data, and workforce development. We voted to approve the recommendations that we agreed upon. And at the next meeting, at our June 22nd meeting, We reviewed recommendation in legislative categories, workforce development, education awareness campaign, evaluation of programs, housing, justice programs, the adverse childhood experiences, harm reduction, neonatal abstinence syndrome and reducing the effects of that, treatment and early intervention and recovery supportive services. And we voted to approve the recommendations we agreed upon, and we also discussed and approved our draft ACRN report. Can I get a motion, or do I have a motion to approve the minutes from our June 15th and June 22nd meetings? Do we have any discussion on those?
This is Pauline. I'll make the motion to approve the minutes from both meetings as submitted.
Pauline,
This is Cecilia. I'll second that.
thank you, Cecilia. John, is this one we need to vote on? Sorry about that. Okay. Then we will vote to approve the motion made to approve these minutes from our June 15th and June 22nd meetings. All in favor of approving these minutes, please say aye.
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 Any opposed to approving these minutes from these meetings, please say nay. And do we have any abstentions for the approval of these minutes from our June 15th and June 22nd meetings?
Hi, Chair. This is Carissa Loper. I am abstaining because I don't think I was at either one of those meetings.
All right, thank you, Carissa.
Thank you.
Looks like we have enough votes to approve those minutes and move forward. So at this time, the minutes for the June 15th and June 22nd meetings have been approved. And we are going to move forward on the agenda. Oh, yes, I wanted to also mention that we have a vacant seat on our committee at this time. Laura Sherwood is no longer a part of this committee. She had another obligation that she had to follow through with. And our state team is working on filling that position. Checking to see if we have the Attorney General's office available to give their informational review. If not, then we will, oh, there we go.
Yeah, sorry about that. My
No,
camera was having difficulty turning on. How are you? How's
good,
everyone?
good. Thank you, Mr. Krueger. I didn't see you there. So at this time, we'll move forward to agenda item number 4, an informational review and discussion by Chief Deputy Attorney General Mark Krueger. Mark, the floor is yours.
Thank you. For the record, Mark Krueger, I'm a Chief Deputy Attorney General. I did not prepare any written documentation for this meeting as I thought it was, since I have presented in the past and most of the members were present, I thought it would probably be more beneficial to open it up for a question and answer session. That way I could address any concerns that people are having or answer any questions, or at least attempt to answer all the questions that people might be having about the use of the funds. If it's that works, then great. If you guys want me to do just a high level overview of use of the funds, I think that's possible as well. And then we can go from there.
Great, thank you, Mr. Krueger. You know, after the last meeting, there were still some questions in regards to the use of the litigation settlement funds. And I think our confusion or some clarification that our committee members were looking for was specifically regarding the reasoning behind the litigation funds not being used for individual payments or settlements to individuals who were affected by the opioid epidemic. Does that make sense? Does that sound right?
Yeah, your question makes sense. It sounds to me like there is some thought process behind using the money for what has been termed victim compensation restitution.
Thank you.
Is the best way I can describe it. You know, everybody's been affected by the opioids crisis in some way or another. And that you guys know from working on this committee that the particular people who've been affected have really been affected with the worst thing, loss of family members and friends, you know, also in exorbitant amount of money they've had to outlay in order to, you know, try to help those family members and friends get treatment and other resources. And it's horrific. The impact of this crisis, particularly across the nation, but particularly on Nevada, has one of the hardest hit states, has been just horrible. And I don't need to rehash all that. You guys live it and know it. So what I will say to you is that everybody, I think, that was doing these settlements, from the Purdue bankruptcy settlement, which is not finalized yet, the Mallinckrodt bankruptcy settlement, which is almost finalized, the distributors settlement, the J&J settlement, and all of the discussions that have been on it have been about what do we use this money for when we get a settlement. And prior to the settlements actually occurring, there were individual lawsuits. You had over 1,600 individual lawsuits filed, which ended up in the MDL, which is a multi-district litigation in the Eastern District of Ohio. Those cases were oftentimes private rights of action, which were individuals that were harmed and are looking for exactly what we're talking about, victim compensation, right, for their loss or the money that they outlaid. They were also governmental entities such as local governments. And we saw that here: Reno, City of Reno, Washoe County, Clark County, City of Las Vegas, City of Henderson, City of North Las Vegas, City of Mesquite, Boulder City. All of these cities that I've talked about have all filed independent lawsuits looking for damages for what they incurred. The state of Nevada also filed a lawsuit, and it also is looking for damage the state incurred. And those are damages that are actually to the state, just like a private individual filed a lawsuit for damages that are incurred for them. Tribal nations filed lawsuits. Most of these lawsuits ended up in the MDL. The state of Nevada is unique because there is actually case law that says we cannot be, as a separate sovereign, we cannot be put into an MDL because we're not in federal court. Now, tribal nations are separate sovereigns as well. However, they file in federal court, so they automatically go to the MDL. So the settlements that have come out of this represent settlements for harm that was incurred by the individual plaintiffs. In this case, the state of Nevada and the local governments, not individuals. Individuals had their own private right of action. Now, ironically, the settlements considered private rights of action in the MDL. They considered the tribal lawsuits, they considered state lawsuits, and they considered individual local governments. When the initial conversations occurred, they were trying to make a global settlement. They couldn't get that to happen. So they ended up carving it off into several different settlements. So with that background, I think it provides you a lot more information as to the mindset going into what the money needs to be used for any particular recovery for a particular plaintiff. In this case, the state of Nevada has expenses that it has incurred because of the impact of the opioids crisis. We're trying to accomplish two things with the use of this money, and the money is restricted by the terms of the settlements and the bankruptcies. And those restrictions are, you will use it for essentially what amounts to abatement. How it specifically says is pretty much, you know, to remediate the harms, risks, and effects of the opioid crisis. That does not include victim compensation. It's not that type of case. So we do have cases sometimes, and I'll give you an example, the Volkswagen case, where there were actually emissions, and we knew what car was sold in Nevada that had an emission problem, and we knew we could get restitution for particular consumers who are harmed by getting their cars fixed. and that was the form of restitution. So we have those types of cases. This particular case, though, we don't have any identifiable restitution. It's not that type of case. The type of case it is the actual impacts and harms that the state of Nevada incurred, and therefore we cannot treat it as a restitution case. So the money that comes in has to go to programs and services and even property, real property if that's necessary, or whatever programs and services you all are making recommendations in the Department of Health and Human Services ultimately creates in the needs assessment to determine what the appropriate uses are. It's not all on the Department of Health and Human Services or even on the Attorney General's office, because the actual driver of the reasons or approved uses of the money is from the settlements themselves. And the terminology of what types of uses are in there. And further, the law, SB 390 in Nevada, provides further guidance, which says the overall uses must be evidence-based practices, et cetera, et cetera. And so at the end of the day, you end up with what amounts to programs and services that ultimately get to the root of the problem and hopefully abate the entire opioids epidemic. That's the goal, right? In so doing, it's going to filter down to individual consumers who are having struggles and everything else associated with getting treatment and off their addiction from opioids. But those individuals will benefit in that manner, and I'm hoping that it will also reduce the amount of fiscal outlay individuals have to incur as they go down the road. We don't know that will occur. We don't know how this is all going to play out. This is new, and we're trying to abate. We have abatement programs set up that are working. We need to fund the ones that work, and we need to establish new ones that we believe will work, and we need to revisit it every few years and make sure that they're working. That's in the purview of DHHS and not the Attorney General's office. So I like to say I'm out there trying to bring the money in, and General Ford is trying to bring the money in, and through our team, and then we give the money to the Resilient Fund of Nevada and Department of Health and Human Services, with the help and assistance of your group, establishes those programs and services that are truly going to abate this epidemic. So that's a long answer for a very short question, and I apologize for that, but I'm willing and able to try to break it down if there's future or more concerns or questions about it. So, and hopefully I answered the question.
Absolutely. Thank you.
Okay.
Um,
And one other thought on that, just to kind of make it even more clear. If you think of it in terms of the different plaintiffs, so you have private litigants who are getting money and they're able to use it to abate their harm, right? And you think of it about the local governments and they're getting their money because they have individual harms, okay? And you think about even tribal governments and they're getting their money and they get to abate their harms with the use of that money. What the state of Nevada did, which I think is one of the really forward-thinking ways of going about things, is SB 390 envisioned it's not like all our harm doesn't somewhat overlap, right? It's like fire. It doesn't care about county lines. It doesn't care about tribal lines. It doesn't care about the state lines even. And so in order to really effectively abate, you have to be able to fund your services in the state, but you need to work with those counties, and those counties need to work with their individual cities within those counties in order to not duplicate programs, in order to complement programs so that those programs and services will actually abate and comprehensively throughout the state, and work with tribal governments. And they did that by allowing that grant programming to be included in it and offset the recoveries of those other governmental agencies like local governments and tribes to say, okay, you can offset your amount of money. We're going to take that into account. We're going to work together to set up something that will actually abate and function across those lines. And I find it to be a unique, this is my personal take on it, but I find it to be a unique, forward-thinking way of working together. And I've been proud to put together that One Nevada agreement with General Ford and all of the local governments, because it established a way for us to fairly and equitably divide the recoveries and have full participation. So you guys are on the cutting edge of something here, and I'm just saying that just for me personally, and I really have an opportunity to do Nevada-wide abatement program. I know that, and my heart goes out to the people who have expended funds, who have victims and have relatives and family members that are victims of the opioids crisis. But this isn't the forum to provide restitution to them. This is the forum to set up programs and services that are going to truly abate the epidemic. So with that said, I will answer questions. I think I was thorough enough, but if I haven't been, I as you can see, us attorneys can always find an answer, right?
Yes, thank you so much, Chief Deputy Attorney General. That was perfect for me. Totally clears things up and cleans things up in my mind. Do any committee members have any further questions for Mr. Krueger? Looking for committee members that have any kind of confusion or need some clarification. If not, we can move forward. And again, thank you so much for that. That was perfect. I mean, that was excellent. Thank you so much. I have one hand up. I'm going to confirm that it is a committee member and it is not. So I'm going to call one more time. Any committee members that have a question for Mr. Krueger or need clarification while we have it. All right. We are looking good. I don't see anybody. I am going to, again, thank you, Chief Deputy Attorney General. We really appreciate that. That was very well done. It was a lot, but also it was really tied things together and made for me a clear picture of what it is we're doing. Thank you.
Great, thank you. And if you ever need me to come back, just let me know.
Absolutely. Thank you.
All right, take care.
Take care. All right, this meeting will move forward from agenda item number 4 to agenda item number 5. This is an informational agenda item where we will review it and discuss the ACRN rated recommendations. All of the recommendations have been rated at this point, and at this time we'll have our state team, Dawn, will go over them with us.
Good morning, everybody. Dawn Yohey for the record. I'm just going to share my screen really quickly. Everybody has this document, but yours is in a PDF form. This is all of the rated recommendations that have moved forward to the director's office for consideration for prioritization. And so the way these are rated on your document and on this document are by the rating total. The way we got this total, again, is by doing the impact, how many people is this going to affect, the urgency of how needed is the recommendation, and then the feasibility, how easy is this recommendation going to be able to be put into place. And so we just wanted to let you know kind of what you're looking at. Let me get this a little bit bigger. The higher the number, the more people it'll impact. The more urgent it is and the more feasible it is. And then we did try to go through all of these and specifically call out the ones that you guys had recommended where we didn't have to change any of the language. There's probably a few in here that we may have missed, but for the most part, we tried to specifically highlight the ones that you guys put in here that didn't necessarily just come from the needs assessment or other state entities. So if you guys have any questions or if you wanted to review this, like it still has over the 100 recommendations. I think there's 150 on here. But it just gives you a little bit of time to see that everything was rated and where it falls. It still has the legislative intent and where it fits in the needs assessment as far as the gap. And yeah, so that's kind of it in a nutshell. We just wanted to let everybody know that it had been rated and you have access to it now. Are there any questions?
I do. Chairman, this is Pauline Sullick. I have a question.
Please, Pauline.
So this may have been said and I missed it, but like, what's the overall rating out of?
Yeah, it's a combination of these three. So I hid these, but what I'll do is I'll unhide these for you guys to be able to see. So it's an average of the impact. So how many lives, the impact magnitude, and the impact health equity. And then the urgency of the need, which is the urgency alternatives, urgency delayed in consequences, and then urgency average. And then the feasibility structure, the ease, and the resource. And so, and then also if it met the legislative target. And then the averages of all of those were added up, including the legislative target. And that's where you come to the rating total.
So out of each domain, out of each column, was the highest rating of 5? Right?
Yes. Yes.
Okay, that's so really. So I was trying to figure out how it came out with the total rating. But if each one was 5 and we took an average of that, then that helps me understand.
Yeah, and what we can do is in the ACRN report that was finalized, it's on the website. It has that handout in it of exactly how all of these were rated through the objective tool. And then plus there was an additional plus a 3%, three points could have been added for meeting a legislative target. I can pull it up real quick if you want to see.
Well, and Dawn, that's, I think, I need a little bit of clarification on that. So the 3 categories, impact, urgency, feasibility, the max you can get is a 5, but on legislative target, the max you can get is a 3. Is that correct?
Yeah, let me pull
Okay.
it up real quick.
Okay.
So that we can all kind of, so that I do not misspeak. So here was the scoring definitions of impact, urgency, and feasibility. And then as you can see, impact for all 3, there was a total of 5 that you could get. Low impacts a small portion of the population of Nevada residents. High impacts almost the entire population with minimal to no exclusions. Number 2 is the magnitude. Low is the minimal impact to health, safety, daily life. High is saves lives and provides major improvement in quality of life or services. And then 3, the relative impact to health equity. And then it also did that on urgency. I'll give you a second to kind of look at this. Urgency was assigned based on the need for timely implementation of the recommendation according to the following factors: availability of alternatives, and then the negative consequences or risk of delay in implementation. And then feasibility had three areas that were taken into account: the current infrastructure, ease of implementation, and then the availability of resource. Again, could have scored up to a 5. And then the target. Did it reach any of these targets? They got an additional 3 points. So it was just yes or no. They got 3 points or they didn't. And did this meet the prevention of overdoses, addressing disparities in access to health care, or prevention of substance use among youth? So those were the 3 targets where they could get the additional 3 points or not.
Thank you, Dawn.
Mhm.
Pauline, did you have another question, or I just saw your hand go down?
Yeah, this is Pauline. I put it down because I think I might be getting in the weeds. So I'm going to think about it a little bit more before I go there.
Great, thank you. I have Dr. Camier with his hand up.
Yeah, question, as far as I can hear here. When we're the legislative, oh gosh, what was it? The legislative priority, the 0 or 3 sort of yes, no. I mean, I'm randomly looking at one, like, let me see here. ACRN recommendation, it looks like it's on page 8 out of 9, 90. It basically has to do with delivery hospitals, screening, treating, et cetera, identifying patients. And I'm seeing that legislative score got a 0. But I mean, I would think that everything that has to do with identification of those with substance use disorder, best practices to treat it, would be directly tied to prevention of overdoses.
Well, if you guys have any questions on the document, you guys can send them over to us and we can get confirmation of exactly, you know, the score. And if it didn't have a legislative target number in there, we can follow up to see why or why not.
Okay, I mean, I'm just randomly, I'm looking at another one. It says established supervised drug consumption sites. These are basically safe injection sites, and these are an evidentiary proven, right, harm reduction model that prevents overdoses, like explicitly, right? And yet, yet this one got a 0. So I mean, I don't know, because I guess we'd have to go through every single one that didn't get a score, right, to determine this.
Right.
But I guess fundamentally, Dawn, like, is the director's office going to be looking at that target number of higher ones are going to get priority basically compared to lower ones? Because then it means something, versus if they're not, then it, whatever.
Right.
I guess it really doesn't mean anything.
Not necessarily. I mean, there are, as we're going through and creating the state plan, you know, we're making sure harm reduction is there. We're making sure prevention is there, data is there. This is kind of a guide for us to look at to see, okay, does this make sense to do something with, or how easy is it to do? And then it's also being used to do a little bit of mapping. And so we have met with all of the other opioid grantees, and we're starting on this document, not this one, but another one that I have, doing a little bit of mapping. So is anybody actually doing bad batch communication programming right now? Is anybody doing disease investigation model? And we're starting to make notes so that we can identify what exactly is everybody in the state doing that has opioid dollars, so that we don't come along and start recreating the wheel, or we can come alongside and supplement and not supplant. So it's more than just the rating total. We are going through right now to make sure to see and to map what is actually being done and what is not being done and what really needs to be done.
Okay, then, yeah, I mean, I guess if you could just sort of pass that along, right? That if this rating starts to become super important, then we might need to revisit items
Of
that,
course.
yeah, thank you.
Yes, thank you for that, Dr. Camero. That makes great sense. I couldn't find the one that you were looking at, but I, after hearing what you saw and read, and it having a 0 rating on the legislative target, it kind of also doesn't make sense to me. And if it were true that the total rating was going to be entirely meaningful and, you know, disregarded if it got too low of a rating, then I think we would have some issues. But it sounds like the team that is working with this document is using it as kind of a guide rather than an end-all be-all decision maker. So that's good to hear. Elise Monroy, you have your hand up?
Yes, thank you, Chair. So I missed a couple meetings in May and June when I was out on FMLA. So I get clarification or a reminder who, I see the scoring methodology that was attached as minutes or to the meeting documentation, but who actually did the scoring? Was it state staff? Was it Mercer staff? Who actually went through this process? Thank you.
It was the Mercer staff with their staff of clinical individuals. I can get specifics of exactly who sat on that. I know Courtney did talk about it during one of the meetings. And then we are going to be asking the Mercer staff to teach a group of us to be able to do the ratings as well. And so we can reach out to some of the ACRN members so that when we have to do this again, we will internally be able to do this as a group.
Okay, perfect. I think that I was just curious to know who did it. You know, it does seem like some of these things are pretty, to me, it just seems like a very subjective process. So I really appreciate that you know, that there's an attempt to make it look objective, like there's something we're measuring against, but I do think this is just a hard yeah, it's a subjective process that we're trying to make objective.
Thank you for that, Elise. And yeah, I totally see what you're saying. It sounds like a great challenge to create an objective tool and keep it objective as we put in subjective information. That sounds pretty challenging, but I think that if we, follow up and ask these kinds of questions and keep in mind that we have a team, not only of our committee, but of the state team that is assisting, that is deeply involved with the population that we aim to serve and the issues around the opioid epidemic. So I think we just keep in communication, keep it, keep it available that we can ask questions. I think that we'll be able to guide this in a way that's meaningful. Do we have any other questions for Dawn at this time as far as the recommendations that have been rated? I do not see any committee members with their hands up. At this time, we are going to move forward from agenda item number 5, and we will move to agenda item number 6, which is again an informational agenda item. It's a review and discussion of the state plan. The next step in the allocation of funds is the development of the state plan, and Dawn will go over what that looks like with us now.
Thanks, Yohey, for the record. We're currently still working on it, going through all of the recommendations and figuring out what is going to be prioritized. Like I talked about a little bit earlier, we are doing that mapping to see what other opioid programs are doing. And so I think that's an important component. And so it's still a work in process. We're hoping to have it, a first draft is kind of starting to get to completion, but not ready to be sent out yet. But yeah, we'll just keep you guys updated. It's definitely a work in progress, and we're moving forward.
Great, thank you, Dawn. So we will be getting updates from Dawn and her team as they get closer to completing the state plan. And I imagine that we'll hear something either at our next meeting or the meeting after that. For now, though, we will move from agenda item number 6 to agenda item number 7. This is an informational agenda item in regards to the report on committee activities and the next steps. So this committee was tasked with getting done some legislative responsibilities, and we did it. It took us some time and some intense meetings that were pretty long. I just want to say thank you for all that you did to make that happen, both committee members and public that was able to attend and participate with comments. Per Nevada Revised Statute, Chapter 433.728, we were required to elect a chair, and we did that. We were required to meet at least twice a year, and we did more than that. NRS 433.730 requires that on or before June 30th of each even-numbered year, we submit a report to the Director of the Department of Health and Human Services And the report has our recommendations concerning the statewide needs assessment, including the establishment of priorities, and to drive this statewide plan to allocate money from the Fund for Resilient Nevada, and we did that. We were required to consider health equity and identifying relevant disparities among racial and ethnic populations, geographic regions, and special populations in the state, as well as the need to prevent overdoses, address disparities in access to healthcare, and prevent substance use among youth. And we did that. We were required to use an objective method to define the potential positive and negative impacts of a priority on the health of the affected communities, with an emphasis on disproportionate impacts to any population targeted by the priority. We were required to have at least one public meeting to solicit comments from the public concerning recommendations. We completed those tasks. What comes next? A report is due each even numbered year. A needs assessment must be done at least once every 4 years. Based on the needs assessment, the director's office will develop or revise the statewide plan to allocate money in the Fund for Resilient Nevada using recommendations provided by the ACRN in its biennial report. So with that being said, we will send out a poll to determine what time and day works best for the committee to meet. It'll most likely be sometime in October. And in the meantime of, our next 2 or 3 meetings, it's going to be over a couple of months. I just like to throw it out there that as a committee, we won't be able to advocate for our cause as a group, but individually, there's still an opportunity to step forward and bring public comment to any hearings or legislative sessions or places that would be working towards supporting the same cause that we're working towards. So just keep that in mind, please. Again, thank you for all that you've done and your participation. It means a lot to have people show up and give their time and effort towards this goal. And I think we did a pretty good job with a little bit of changes in staff and challenges with the virtual age that we're living in, but we got it done, and it was pressure filled and definitely challenging and iffy at times, and we did what we could, and I appreciate you guys. For now, we'll move to agenda item number 8, which is another informational agenda item, and we don't have specific dates for upcoming ACRN meetings, but we will send out that poll to determine dates and times of our next meetings. Again, we're looking for the first one or our next meeting to occur probably in October. So please respond to that as soon as you're able so that we can come up with a group consensus so that we can get quorum and participation from the committee members. Just as a refresher, a reminder, we do have an open seat on this committee at this time, and the state support team is working on getting that position filled. Do we have any questions about agenda item number 8, or I'm sorry, agenda item number 7 as well? I kind of just jumped right out of that one. Right, I don't see any committee members with any questions. I'm going to move to agenda item number 9, which is public comment number 2. Again, public comment will be taken during this time, and in consideration to others who would like to provide public comment, please avoid repetition and limit your comments to no more than 3 minutes. Do we have anybody available or interested in public comment at this time? I do see one hand up. It looks like it is Katri. She just disappeared. Joan, can you? Oh, there we go. I got it. Katri, if you'd like to speak, there you go.
Hi, thank you, everyone. Grand Rising. This is Katri Saunders for the record. I was just inquiring when the Attorney General was speaking about restitution for the people that were affected by the opioid epidemic. How is that going to get addressed? Are there any restitution for the people, or just the restitution goes to the programs?
Dawn, do you want me to take this one? Or how does this, is this a question and answer thing? It is not a question and answer thing. Well, that's a good question, Katrie. Chief Deputy Director Krueger gave us a great explanation, and his explanation will be in the minutes for this meeting that will be posted on the ACRN's website, and it totally clears up and clarifies the question that you just asked. Did you have anything else that you wanted to make a comment on? I'm sorry.
No, not at the moment. I just wanted clarification, because it seems like a lot of talks and discussions are going towards just programs, and not necessarily any money going towards those who were affected by the opioid epidemic. So I'm just inquiring, how is that going to help some people when they need financial assistance, and that going forward? So just wanted clarification on that. Thank you so much for your time today.
Thanks, Katrie. And yeah, thanks for your question. Again, once we put out the minutes for this meeting, you'll get a pretty clear answer from Mr. Krueger's address to this committee. It'll be pretty straightforward as far as getting a better understanding of what that looks like. At this time, I'll move forward to see if we have any other public comment at this time. Joan, do you see anybody else? I don't see anybody else with their hand up. Let me just double check. I don't want to miss anybody.
I don't see anyone.
Thank you, Joan. All right. I am going to move forward from agenda item number 9, which is public comment number 2, and we're going to move to adjournment. Thank you again for joining us and participating in this meeting. We will be sending out that email with the options for our next ACRN meeting. Once we have a consensus of what time works and what day works best for the committee, we will set the next meeting time and day along with a agenda and the minutes from this meeting. Thank you for joining us, and thank you for your participation. Take care and have a good one.
Thank you.
Thank you.